Hello and welcome. I'm Heather Cronus-Danek, Senior Director of Development for Individual Giving for the Ioneer Foundation. It's my honor today to host Sight and Sound Bites, our bi-weekly webinar series that rotates between topics between the Department of Otolaryngology and the Department of Ophthalmology, the two areas that we support at the University of Pittsburgh School of Medicine. We are able to support these two amazing areas because of your support, our friends and our donors and everyone who joins us. A few housekeeping tips before I introduce today's speaker. Chat is disabled. Please feel free to put questions in the Q&A, and I will ask our speaker today those questions at the end. If we don't get to them, we will get an answer back to you. Also, if possible, please do not ask personal medical questions. Should you have one, you can send it to Ioneer Foundation directly. So today's topic and our speaker is Dr. Susan Whitney, professor in physical therapy and otolaryngology at the University of Pittsburgh. Her topic today, an update about benign paroxysmal positional vertigo, the most common type of dizziness and spinning. Dr. Whitney has such an amazing background. I'm going to read you a few things. She is the co-director of the Master of Science program for physical therapists at the University of Pittsburgh and is a fellow and a member of the board of directors of the American Physical Therapy Association. She holds a joint appointment in the Department of Otolaryngology. Her research interests relate to persons with vestibular disorders and falls. So I am really excited to introduce Dr. Whitney, and I am really excited to hear this topic. It's so important to all of us as we age. So Dr. Whitney.
Thank you very much. It's an honor to be here with all of you today. I literally sometimes spend an entire day teaching physical therapists and physicians about benign paroxysmal positional vertigo. I'll call it BPPV because it's a lot easier than that mouthful of words I just said. I'm going to start with a little information about BPPV here. Let me get my mouse to work here. There we go. So what's the issue here? What's the big deal of this mess? BPPV is the most common type of dizziness or vertigo. So some people have these loose crystals that I'll talk about in a minute and they're dizzy, and some spin. And what's very interesting is that we've learned recently in the literature, but I've seen it in clinical practice for years, is that the older people get, in their 80s and 90s, they may not even say they spin. They just say they're lightheaded. So that's not uncommon at all. And I've literally treated people with this condition for almost 35 years. So this is something that I know a little bit about. It can cause people to fall down. So there's good data that if you put the crystals back in the right place, because these crystals are in the wrong place, I'm going to show you that in just a minute, the people fall. And that's very bad, especially as you increase in age. And it decreases people's quality of life. There's a paper that just came out this morning that I saw that suggests that when people have loose crystals, they don't feel like they can do all the things that are important to them in their lives. So this is a problem that needs to be identified and fixed. And those are some of the things that we're working on here at Ioneer to try and do. And it can make people fearful to do things. So people become afraid to look up, afraid to reach, bend over. And any of you who are living with BPPV or have had it understand what that means. And the chance of getting BPPV increases as you get older. So it's not uncommon as people age for people to develop it, even though they never had it when they were in their 20s or 30s or even 40s. We do see it across the lifespan, but it increases as people get older. The youngest report of this condition is in a 6-year-old, but that's very unusual for children to have this problem unless they hit their head really hard. That's the most common reason why a child would actually develop this problem. I wanted to show you, I know you're not anatomists, but you need to understand what this is. So this is the ear. So this is the part we all look at and we say, that's the ear. But if you go inside and if you've ever had children or heard of inner ear infections, this is your eardrum right here. Now these little bones that transmit the sound into your hearing organ, which is in the front here. And this is where we have, we talk about inner ear infections right here in the eustachian tube area, but, or middle ear infections, excuse me. But right here, see these loops? That's what we're talking about. These loops here are where the debris ends up, and it belongs right here. And I'm going to show you what these crystals look like, because most people want to know what they actually look like. This is a side view because it's a little easier to see. In the front part, if any of you've come to any of the talks that Dr. Palmer's given related hearing loss, etc., this is where hearing occurs, right here in the front. And the nose is over here. And these again are the loops. And loose debris can be in any one of these loops. There's 6 choices. There's 3 on each side, and they don't talk to each other. They're separate organs. So this is one. This is actually a left inner ear, and this is the front. So this would be front if you were facing forward. This is the hearing part, and this is the balance part here. And that's what this section does. It actually tells you whether you're moving, tells you up and down where you are, and it also tells you about your balance. It sends a signal to your brain and says, okay, so you just move to the right, or you move to the left, or I tip my head up or down. So I call it a gyroscope right here. And when the crystals in this organ here fall into these loops, what happens is the gyroscope goes wonky and it doesn't work right. And it sends signals to people's brains that they're spinning, or they're dizzy, or they're lightheaded. And it should only occur if you have loose crystals when you change your head position, which would cause things to move in here. So when you move your head, and it should last under a minute. That's can sometimes go longer. But if you have it, you can't really sit there with a watch and say this is a minute, because your eyes are moving. So we typically see the eyes move, last under a minute. There's often a little bit of a delay, and it wakes people up at night. And it can also happen, especially when people are lying down and they sit up and all of a sudden they're spinning. So those are some of the primary things I ask people: rolling over in bed and lying down to sitting up. And if you say yes to those things, that it makes you dizzy or lightheaded, then you need to be checked to see if you have these loose crystals. Now, again, I wanted you to understand this is where the crystals live, here and here. All right. And these are those loops that I just showed you. So there's 2 little spots where these crystals live, and they can actually fall back through, usually through this area right here. And they can even go in the top canal, which doesn't make sense. But if you tip your head or you do yoga, the crystals can actually end up here too. They usually end up in the bottom one just because of gravity. So we know that it happens more on the right than the left, 60% versus 40. And it's usually in the back right canal, but it can be anywhere. It can be any of those 6 canals. And you'll hear about some people being dizzy after a concussion or a brain injury. We know about the concussion protocols. If you're in America and you listen to all the football games, they talk about they're in the concussion protocol. The reason is that this organ here, that is your balance system, lies right on this bottom bone. And if you bang the head, you can bang kind of the system here, and people can be dizzy after a concussion. But they can also, if it's really serious, sometimes they'll actually have loose crystals from a bump to their head. So that hearing system faces forward, and right back here, these loops face towards the back of your head. And it's a little confusing. I just put this in so that you understand that it's all about angles. So if you have loose crystals, you need to find somebody who knows what they're doing, because it's all about putting these canals in the right angle so we can move the crystals back where they belong. So I have this to try and show you a little bit, but hopefully you can see this green here. All right. And if I tip this inner ear the right direction, can you see that the particles are falling? But if I tip the head this way, they stop moving, and they're not going to go back to where they need to go because they don't belong. There should be no crystals, and well, we don't know that for sure. But everybody may have a few missing in the wrong spot. But we know when people have a mass of these crystals in this canal, or any of these canals here, and you move, people typically spin. That's what we think. That's what all the experts in crystal movement say around the world. All right. And just to show you, the crystals that live here in this little where the little white specks are, you tip your head back and the crystals can fall back here, and that's in that back canal that I was talking about. This is an animation that Dr. Hain from Chicago put together years ago. Now we're just a little more information. It's pretty complex at times because this is if it's in the back canal, all right, or in the back side. This is where it's usually pretty easy to fix and identify. But we're learning that it can be on either side of there's a stop sign essentially at the end of the canal, and it can be on this side or that side. It can be stuck or it can be loose. And we also know that sometimes people's anatomy can be different than this big open blue area here where the crystals would move. And sometimes people's anatomy, it makes it kind of small, so it's hard to move those crystals through. So people's anatomy can also affect the outcome and how long it takes to get it better. Generally in the literature, they say 1 to 2 treatments is the average time that it takes to find the crystals, figure out which loop they're in, and to move them into the right spot. But there are things that may get harder to fix, like if you have a stiff neck, or if you've had other medical problems, it can make it a little bit more of a challenge to fix. And we use the models like I just showed you to help people understand this problem of BPPV. And we actually label which canal it is and try and make it understandable to folks. Now, everybody that I ever treat wants to know what these crystals look like. So I'm going to show you both in a movie and in a human, and also in this is a human model here, and this is not a human model. This is a real human ear. I'll be honest. But doesn't that look like a crystal that you'd see at the museum? If you went into the museum, they really are pretty, and they kind of are stacked on top of each other. So this is a younger person who has, these things are called otoconia. We call them loose crystals. Some people call them rocks in your head. Your doctor can call them all kinds of things, but it's called otoconia. That's what they really are. Now, this is an older human otoconia. Can you see the difference? This one's probably the best to look at. Can you see the fissures here? It's not smooth anymore. I'm going to go back and show you to show you what I want you to look at. See how smooth this is here? And even here, it doesn't look like it's got wrinkles in it, right? Now, I always tell people, and people don't like to hear this, but our voices change, our strength changes as we get older, and so do our crystals. This crystal does not look like the one I just showed you. It kind of looks like it's been beaten down a little bit. It's the same size, but it's not as smooth. And we think because of this, they may actually be more likely to fall out of where they belong and go into the loops, those semicircular canals I just showed you. And I wanted to just show you just for a second what this looks like. So this is opening up someone's inner ear, that little skinny loop that I just showed you. And that white little blob right there, that little blob is otoconia. And this is a person who had loose crystals. And they actually found the loose crystals in the ear, because for years we weren't sure whether the theory was right that this was loose crystals, but now we know that it is. This might be a little louder than my voice, it usually is, but I wanted to show you the test that if you had suspected loose crystals, this is the test we do to figure out if you have loose crystals. Now, what you're going to do, this is named for Dr. Dix and Dr. Hallpike. Dr. Dix was a woman, I'm very proud to say, and Dr. Hallpike was a man, both from the United Kingdom, from Great Britain. And can you see these 3 loops here? So there's 3 loops here, and what you're going to see right down here is a box, and you're going to see eye movements. And some people don't like to look at it, but the eye movements are here, and you're going to see the eyes jump, all right?
Now we're going to talk about an alternative particle repositioning manoeuvre known as the Epley. But we start by looking at the Dix-Hallpike manoeuvre precisely as it was first described. The head is turned to the right, and we'll drop the patient backwards. just
watch-
so the head is hanging.
Watch the eye.
There we are.
And see the debris up
And we
here
can
moving?
see the upbeating geotropic
Now
nystagmus.
those fancy words mean that eye is jumping. So that's what I look for in any physician that you're going to see
Are you all right?
is the jump.
Yes, everything is turning a little though. Everything does turn as the nystagmus appears. And as the nystagmus dies away, we wait till it finishes.
Now when they come back
To
up,
complete the manoeuvre, we sit the patient upright.
so it wasn't fixed.
And here we see a reversal of the nystagmus.
So we can tell which, it sounds crazy, but we can actually tell which way this otoconia is moving, or these otoconia, it's not one, based on how the eye moves. So if the eye goes this direction, we know that it's moving away from this blue thing. Blue thing is the stop sign, that's the block. And what you want to do is move this from here to here, and that's what we try and do. And we don't really know what happens when we put them back in there, to be honest. There's one study that says that they get restuck over here, and another study says that they get absorbed by the bloodstream, but we don't really know. But we do know that people get better, and that's the most important thing. So this is the actual test. There's different treatments that we can do, and we try and keep up to date on all the most recent treatments.
Now we're going to talk
here to help people. So I wanted to tell you our story. So what are we doing at Eye and Ear to help people who have loose crystals? Obviously, we treat them. I treat patients. We try and fix these loose crystals. But I want to show you a little bit more because we have a global reach in terms of what we're trying to do here that will affect people around the world. In terms of, I'm going to talk a little bit about guideline development. So I was involved as the physical therapist for the first BPPV guideline that was developed for by the American Academy of Head and Neck Surgery. It was an incredible honor for me to do this. And I represented physical therapists around the globe. And the second one I couldn't do because I was teaching in New Zealand, but it was an incredible experience to be able to formulate the first guideline. We're also helping clinicians make the diagnosis of BPPV, and I'll explain what that means. We're helping clinicians around the world better understand if they need good goggles to make the diagnosis of BPPV. I'll tell you of a current study that we're doing. And we're trying to help people by providing teaching materials to educate the world to help people living with dizziness at Eye and Ear. And we're also educating people around the world about the diagnosis and treatment of people with different kinds of dizziness. So I'm really focused on BPPV today, but there are a lot of other things that we are doing to try and help people with dizziness here at Eye and Ear. We have actually the most physical therapist PhDs of any institution in the world studying vestibular disorders that affect people. So Dr. Dunlap, Dr. Kirkwald, almost Dr. Harrell, who's a doctor of physical therapy, but hopefully will be a PhD soon, Dr. Klatt, Dr. Sparto, and myself. So there are literally 6 of us. There's nobody in the world that has this kind of team here. And we have the honor and pleasure to work with Dr. Joe Furman. So Dr. Furman was my mentor on my PhD project, and he has actually mentored all of these other physical therapists in different ways, except Shilpa, who just arrived about three or 4 weeks ago here to work with us. And so he's just been wonderful and is the leader of our team. Guideline development, let me tell you a little bit about that. So as I said, I was honored to be involved in writing guidelines. And for those of you who don't know what a guideline is, guidelines are consensus documents, meaning lots of different kinds of people have to be involved in writing them. And you put them out there for the world to use. And they're all free access. So if you put in into your web browser on your computer, your cell phone, clinical practice guideline BPPV, this would come up for free. Now, the new one would probably come up too, that I was not able to participate with. It came out in 2017. But these are used by people around the world to figure out how to best care for people's problems, whatever the condition is, whether it's colon cancer or loose crystals or dizziness. So I participated in 2 clinical practice guidelines also related to the treatment of people who have a different kind of dizziness. So these are things that people around the world use and in their practice to help them. And I wanted you to know that there's plain language summaries about BPPV that the American Academy of Head and Neck Surgery has provided. And these webinars are put online. So if you don't have to write it down now, but if you were to go to this URL and type that into your browser, you would be able to come up with information about frequently asked questions for BPPV and read them. And they're written in 6th grade language, so people can look at it and they understand. So it's not fancy language, it's very clear, and it helps people understand about BPPV. So that's one of the things that I help contribute to. But this is the most recent one that you can use to look up for the most recent information. We've also been helping people to make the correct diagnosis. So this is another initiative that we've got ongoing here at Ioneer. And this is, I want to show you this because it's really fascinating. This is post brain injury, or after someone hurt their head and the person had no dizziness. So there's this thing called vestibular agnosia that Barry Sigmanol is working on in the UK. And we also are doing some things here at Ioneer and Pitt. So I want to show you this. It's a short movie, and Barry is talking to his patient. And there's some fancy language here, but I want to show you what this actually looks like, this condition.
1, 2, 3, go, 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 well done.
So he brings him down
eyes on-
and watch his eyes here in
Okay,
just a
come
minute.
with it,
You
the
can
camera.
see
Look at me.
that's
Okay, are you
BPPV.
feeling dizzy or not?
No,
You're not feeling dizzy?
nothing.
No, not feeling dizzy. Okay.
So he goes on and treats him, okay? And what happened was he's calling this thing vestibular agnosia. So this is a new form of BPPV. And at the same time, about a year or two later, well, that paper came out in 2022, Dr. Harrell, who's working on her PhD with Dr. Furman and I and Dr. Sparto and the rest of the team here, we reported the same thing. And so this is really kind of cool. This was done at Mercy Hospital here in Pittsburgh. And what Dr. Harrell did was she tested 76 people who came to the brain injury rehab unit to see if they had loose crystals. And over 50% of those 76 people who came to the hospital at Mercy had loose crystals, but only 10% of those people who had the loose crystals could say that they were spinning. And that's what that vestibular agnosia is. You have loose crystals, but you heard him say, I'm not spinning. So we've done that. And then right below there, I pulled a paper that we wrote in 2005. And this is a paper that actually helps clinicians diagnose loose crystals by asking 2 important questions. And what we found was that if they answered yes to 2 important questions, which were rolling over in bed, does rolling over in bed all the time make you dizzy? And does going from lying down to sitting up always make you dizzy for under a minute or whatever? And if they said yes to those things, they were 8 times more likely to have loose crystals. So that's a paper that we published, 15, 20 years ago almost. So right now, what I'm doing with Dr. Sigmanol and his team at Imperial College London is working on a paper about falling and dizziness. We're going to review all the literature and try and see if there's a relationship between dizziness and falls and bring that forward. Because in the new guidelines for falls that came out in Europe, they barely mentioned dizziness, and we think it was a mistake, and we want to fix that. So that's our effort to try and improve care around the globe. We're also helping clinicians to better understand if they need good goggles, those goggles that we use to look at eye movements to make the diagnosis. And so I just wanted to show you, this is a different type of BPPV. This is in the side canal. See the yellow here? That's where the crystals are. And this is what Dr. Bandari is doing in India and doing simulations. So they're putting people in different positions here. And what they're trying to do is show biomechanically how these crystals move when you fix BPPV. So this is a maneuver that was designed for the side canal. And you can see the yellow disappear. It's going back where it belongs. And then people are better, right? So we're trying to educate people by showing them maneuvers like this and showing people this is, again, a different type of BPPV than the back one. This is in the side canal, but this is the zoom in maneuver. And what we do is they're brought down to the side like this. And I want to show you, because he does a really nice job of showing the red here. See the red there moving? You can actually see as she moves through what's actually happening to the crystals. So she goes nose up and the crystals move a little bit there. And then she's going to turn her head. And did you see that? The crystals fell back where they're supposed to go. And when she sits up, the crystals are in the right place. So we use things like this to teach our patients. But what we're trying to do right now with Dr. Cassidy upstairs and I and some others is we're trying to determine what the eye jumping means to someone's function. So can you see the little crosshairs here? This is a good pair of goggles. And these really can show the eye movement and how much it's twisting and how fast. So I'm working with an engineer from Ohio State to do this project. And you see Dr. Cassidy sitting here. And this is someone in that position where we test for the crystals. And what we're doing is we're recording this with their consent, of course. And then what we're going to do is see if the amount of jump that they have relates to how they move, whether they've fallen, how they feel. Because we see all this jumping, but we really don't understand what the jumping means to the person. And we want to find out if it's really important to know about the intensity, how big and how much this jumping they have, and does that relate to how they move and how they feel. So I think it's a very exciting project that we're working on. We're now working to provide teaching materials to educate people and the world to assist people living with dizziness. I actually was in charge of this group. It's called the Vestibular Special Interest Group that's part of the Academy of Neurologic Physical Therapy in the United States. And what we did was we started putting together fact sheets for people like some of you who have had BPPV about what is BPPV. And it's in simple language. And then I have a lot of friends who speak different languages. So we have information in Arabic. We have information in, I think this is Mandarin Chinese here on the bottom right, and also in Spanish. We've now done this in French, et cetera, but it was my effort that started this. I didn't do all the work. Believe me, there's tons of people. And for all these projects, there's tons of people. So I'm just one small cog in this whole thing, all right? But what we've done is expanded this, and I'm the vice president of the International Neurophysiological Group of World Physiotherapy, and we're expanding this to beyond loose crystals into other areas of dizziness too. And Chuck Pliska is actually working on that as the chair's group from Louisiana. We've also got podcasts, and part of what my efforts have been to try and expand knowledge to people around the globe is we've participated, the faculty and staff here at Eye and Ear and Pitt have participated in podcasts that relate to management. Mine was management of vestibular migraine, and Dr. Sparto did one on virtual reality. Dr. Furman did one on whether I pulled his, but he's done some too. So we've really, here it is. He talked about vestibular migraine. So what we're trying to do is not just educate the community here in Pittsburgh, but also educate the world community so that anybody who walks into the clinic with BPPV or another vestibular condition, a dizziness condition, gets the right care. This is an international effort that I've been involved with now for probably 1.5 to 2 years. That's led by Alex Bisdorf and Raymond Vanderberg. So one is a neurologist in Luxembourg, and the other one is a surgeon in Belgium. And what we're doing with this group called the Baronet Society is trying to get educational materials to people everywhere around the globe so they can teach people about BPPV and other things and improve care. So our group has people from at least 4 different countries. We've published a paper about what we think a physical therapist and physician, neurologist, otolaryngologist, et cetera, what do they need to know about inner ear problems? And there's kind of basic level, kind of intermediate and advanced levels. And what we're trying to do is gather all kinds of materials on a site to see if we can provide these materials to people locally. So this group, the Veronese Society, is working with the International Neurologic Physical Therapy Group. There's also a group in Europe that we're working with called DizzyNet in Munich to try and have the physiotherapists there help. And we've also got a group of eye experts. I mean, it's eye and ear, right? This Novell group that is going to store movies so that when people are learning about BPPV, for example, and someone's teaching them in their country or their city in the United States, they can pull information from this novel site and teach the right information. And we're trying to see if we can get some money to support this effort so that it can be free, because we don't want people to have to pay for that. It's important that everybody have good access around the globe and also in rural America. I'm working as a member of the executive board of this group to provide high quality teaching materials. So that's our goal, which I think it's pretty lofty. It's been a lot of work and it's moving forward. I think it's very exciting. I wanted to talk about a little bit more about educating people around the world about the diagnosis and treatment of persons with various kinds of dizziness, what Ioneer's doing. And this is we have an advanced vestibular PT program that we put together. This is our second class. There are certain requirements that people have to get into this program. And what we're doing is we're really trying to train the experts to be super experts. So when they go home to their communities, wherever they are in the world, they are really going to be the go-to person, and they'll have somebody there who can help them and they can learn and improve care. So we've had people, the first class had people from Argentina, Australia, Belgium, Brazil, Canada, England, Ireland, Germany. I know now we have folks from Saudi Arabia in this class. We've got at least one person from Argentina. We've got somebody from India, but the faculty are superb. Absolutely superb. So we are blessed to have the best people in the world. So we've got people from Johns Hopkins, at least 3 or 4 of them that participate in this program, the Mayo Clinic, Imperial College London, University of Minnesota, University of Arizona, et cetera, Trinity College in Ireland. We've got King's College London, University of Queensland from Australia. So we've got this amazing team of people who are training the experts to be even better and hopefully will improve care. We've also got for the last 17 years, this will be our 17th year that the Department of Otolaryngology and the Department of Physical Therapy co-sponsor a course. We've educated people from around the globe, and the money that's generated from this course goes to vestibular research. So when people pay their money, what happens is it goes into the pot. And these are some of the key people who participated, and all of these people pictured here have a very strong connection to Pitt, including Dr. Staub, who's at the Mayo Clinic. He's the chair of psychiatry there. Dr. Staub is a Pitt graduate, the University of Pittsburgh graduate, of which we're very proud. So this is the ad for this year's coming course for our 17th year that we've worked collaboratively between the Department of Physical Therapy and Otolaryngology to improve care. So where are we headed with BPPV? All right. What we need to do is we need to train more people to be able to recognize BPPV to improve people's lives. That's what we need to do. We need to make it easier for people to diagnose BPPV, to decrease errors made by healthcare providers. It's often misdiagnosed. It's not uncommon for people to spend months trying to figure out what's wrong with them, and lots of copays and dollars to make the diagnosis of BPPV. People, and especially in women, physicians sometimes slough them off and say, oh, this is the one that makes me crazy, is when people come in and say that my doctor says it's normal to be dizzy because I'm old. And I go bonkers when I hear that. And bonkers means crazy because dizziness is never normal. When I talk to physicians, I always say, when I'm at a physician meeting, I'll say dizziness is never normal. It's not something that you should get because you're old or older. There's something wrong if people are dizzy. Could be your heart, could be your dizzy, the vestibular system, but there's something wrong if people are getting dizzy. BPV is often misdiagnosed, and it can take people a lot of time to get the proper treatment. And it can result in broken bones and injuries to people's heads, brain injuries. People fall down sometimes with these loose crystals. That's why I like to try and make sure people understand when it's gone so that they start to move more normally and don't become fearful all the time. So BPPV is an incredibly complex, well, people think it's simple. To me, it's complex because I know all the strange things that can happen. So it's not quite as simple as we all think. But our efforts here at Ioneer, we're really trying to affect care globally. And part of it is through education, part of it is through research, some of the things that we're doing that can directly affect people's lives and how they move. And obviously to prevent fractures too, because we don't want anybody to break anything when they have BPPV. So I want to thank you. And I was told to finish with lots of time for questions. So hopefully I didn't talk too fast for you. I'm going to get out of this and we'll see if there are questions. And as long as there are questions, I'll try and answer them.
Dr. Whitney, that was great. I'm going to ask you to demonstrate the examples you gave with the model of the ear because you weren't on the full screen.
Oh,
We only saw them, but so could you do that for us? Because it's
Sure.
very interesting.
Sure. So now I can see the screen. So here
Okay.
it is. Sorry about that. So this part over here is your hearing,
Mm-hmm.
and this part here is your balance part. All right. And right in here, so I can show you right in this area here, that's where your crystals live. We all make them. They're constantly being made, constantly being absorbed. So they're right, so I can do that right there.
Mhm.
What happens, we think, is that the factory that makes these may not be making them perfect. And then when you tip your head back, let me do it on this side. When you tip your head back, say the crystals are here, when you
Mhm.
tip your head back, let me see, oh, it's this way, I guess, this way, they fall in here. Our job is basically to get the stuff from down here back up here into this area. All right. And so I always call it like loose bolts in your engine. When the bolts are attached to the engine in the right place, your car runs beautifully.
Mhm.
When bolts are attached or loose, your car runs rough. And that's how I try and explain the loose crystals. The car's running rough because these things don't belong in the right place. And what happens is, if you can imagine, let me see if I can show you. So here's the stop sign where it's a dead end down here in the back. When these things move in and up and down like this, you're spinning because they don't belong there. Your brain interprets that you're actually moving and that you're going like this. So most people will say they spin. They say if they use the word vertigo,
Mhm.
this. Other people will just say, I feel like I'm moving. So the words aren't critical, but when the stuff moves in here like this, that's when people are spinning. Just like with this model here, I really apologize you couldn't see that.
Oh, no, it's fascinating. We were loving the presentation, but it's nice to have it on a bigger screen.
Yeah, so let me see if I can get it over here so you can see it better. But see when
Yes.
the debris not moving, you're not going to spin. That's why when I ask people who are living with loose crystals, I'll say, when you're still, are you spinning? And they say, no, it's only when I move, right? So let's move him. So if I move the ear, see those crystals falling?
Mhm.
That's when people are spinning, and it lasts a while, right? And then when they settle, like down here, and they've stopped moving now, then people will say, okay, it stopped. And then if I move their head a little bit more, they'll say, oh, I'm spinning again, Sue, I'm spinning.
Mhm.
So that's typically how we know that we're moving the crystals, and that and based on how the eye moves, we know whether we're going in the right direction. So
Gotcha.
we can tell if we're going in the wrong direction, the eye goes this way. And if I'm going in the right direction, it goes this way. So when I use those goggles to look at people's eyes,
Mhm.
I can basically say whether you made the right turn or the left turn, whether it went the right way or not, or whether it went from this, like, for example, it can go from the back canal into that side canal that you can sort of see here. because sometimes it can be in more than one canal. It can be in 2 canals. It can be more than that.
So, I think, and if you'll talk to this a minute, I think there's a greater awareness of the issue of crystals and
Mhm.
vertigo, dizziness. I mean, as a personal story, my college roommate more than 30 years ago had ear surgery with Dr. Barry Hirsch. But afterwards, she had some issues with crystals. And at 22 or 23, she would get dizzy. She'd have to sit down and they'd constantly have to do different maneuvers. None of us had heard about that at that point. So I think there is a much greater awareness of this issue. What are your thoughts?
Oh, absolutely. Because, well, until 1995, nobody even believed that people were like, I'm not sure that this even exists. And John Epley, who developed the first treatment maneuver in the United States, Dr. Epley, they were trying to bring him up on malpractice, grounds, because they said that he was a charlatan and that these crystals didn't exist. And he wrote a paper, and by the mid 1995, 96, people actually started believing it. But until then, people didn't believe this even existed. And so older physicians may or may not be aware of it. The younger ones maybe, but you have to move the head like you saw that movie.
Yes.
And if you don't do that, you don't know. And that's the problem, that when people go in to see their doctors, they won't always do that test, or they don't ask the right questions. Sorry, but they don't ask the right questions to know that it's loose crystals.
Exactly. Well, in reference to asking questions, we have a whole bunch of them.
Oh,
So
okay.
let me start with just a few. Can Epley's be done at home, or is an appointment recommended? See, that's a question I would ask. I mean, and it goes with another one we have, which is, what about preventive care? Are there exercises that someone
Well, I
could
can
do?
only do one at a time. Let me
Okay,
do
they're
the
two
first-
different
the
things.
First one's long. Yes.
Okay.
But let me tell you about the self-care thing.
Okay.
Does it work? Probably. Does it work all the time? Absolutely not, because I see the failures. If you're nervous, you definitely want to see a physical therapist or a physician. There's a paper that I just got. It's going to appear. Well, it just was published in the journal Neurology, and there's something called Neurology Today that they asked me to comment on that particular paper. So a friend of mine, Jisoo Kim from South Korea, published this large randomized trial looking at exactly what you just asked. But they took people who had recurrent loose crystals.
Okay.
And what they did was they used artificial intelligence. And some of you say, what is Sue Whitney talking about? But it's using a machine to help figure out what your diagnosis is. Okay. So what they did, and we're using that for other studies that we're doing. I'm working in artificial intelligence too. So what they did was they have this questionnaire, to like the one that I developed in 2005, with a couple extra questions, and they think that they're pretty good at figuring out which ear it is and which side and which loop it's in. Okay, with fairly good accuracy. But these are all people that have done it before. And then they give them this video and see if they can fix it. And they did pretty darn well. So that'll appear probably in the public soon. All right.
Okay.
Now, what I did was I talked about what's good and bad about that. All right. And one of the problems is that it's not so easy to do on your own. And what they said was that a lot of people, 80% of the people, I think it was 80 or 20, I can't remember which one it is, but a lot of people needed somebody there to do it with them. So in my mind, it's harder to do on your own. There's an earlier paper by Jisoo Kim too, that says that only about 25% of the time, if you have it again, so you come into me and I say, we'll go this way because it's easier to say in this loop. And I say, it's in this is the left ear. It's in the left ear and the back canal. All right. And I tell you to do it for the left ear and back canal. If you get it again, what Jisoo Kim showed was that only 25% of the time is it in the same canal and on the same side. So without using this artificial intelligence program, I there's only a 25% chance that if you came in today and 6 months to a year later, you came in again, that it's on the same side in the same canal. And then what happens is it can get, sorry, but this is the honest to God truth. It can get stuck in there. You might be right, it might work, right? But it can get stuck in another canal. It can get stuck in that canal that you're trying to fix, all kinds of nasties. So I don't know. I always figure you got to be really smart to try and fix it on your own, and because it's really easy to get it jammed up and in the wrong spot. So I'm not totally sold on it yet.
Gotcha.
Yeah, I'm worried about it.
So this leads to another question. Once you have an incident where the crystals are dislodged, is there an increased chance of it happening again?
Yes. Sorry
Okay.
to say.
Sorry.
15% recurrence rate per year is there was a recent, there's something there, what researchers sometimes do is they look at all the papers that are out there to answer a question. And they looked at all the literature that was out there. This was published within the last month or two. And they tried to say, okay, how often does this come back? And what they reported was about 15 people out of 100 will get it in a year. Those same people that started 2 years ago, 30% of them will have had it again. And if you go out 3 years, it goes up to about 40 out of 100. So that Whitney always says, if you live long enough, you'll probably get it again.
Gotcha.
Because but you can't live like it's going to happen tomorrow. You have to live normally. That's a really important take-home message. If you don't have it, you don't want to live like you have it, because then your neck gets stiff, your back gets stiff. People don't move in bed. We don't want to see that. We want to see people. There's no data that says that you have to sleep in any position to avoid it, because one of your questions was, how do you prevent it, right?
Right, because there was a question about preventive care.
Yeah, and I would be asking you too if I were online. There's one study out there. Well, that's not true. There's a series of studies, but there's one really nice trial. It's called a randomized trial, which is like those ones we have a tendency to really believe those. All right. And in this particular trial, again, by Jisoo Kim, who is a genius out of South Korea, what he did was he looked to see if there's this idea that these crystals, which we know are made of calcium carbonate, which is like bone. All right. That if you had less vitamin D and calcium in your bones, that you might be more likely to get loose crystals. And there's big studies out of Taiwan that show that if you look at millions of people, that that this might be real. So what he did was he tried to study it. And what he did was he found that if you're low in vitamin D and calcium, so that's a blood test. You did a blood test and your doctor found that you were low in vitamin D and calcium, you're more likely to get loose crystals again. So if you've had BPPV, these loose crystals, it's worth actually taking a blood test to see if your vitamin D and calcium are low. And if they're low, there's a specific amount of vitamin D and calcium that they supplemented. They gave people for over a year. And what they found was that the people who took the vitamin D and calcium who were lower, their recurrence rate was less. So that's one of the few things in the literature that says that you can actually potentially prevent it or slow down the chance of you getting it again. This vitamin D and calcium supplementation that you can take, with a pill or something.
Well, and those are things that PCPs recommend for many patients. So that's good preventive care for a lot of things. Okay.
Yeah. Can I just add one more little thing?
Yeah.
Some of you will get it seasonally. You'll get it in the spring, for example. And we think that there's some work done from California and also in Brazil, northern and southern hemisphere, that suggests that if you have you're more likely to have loose crystals in the spring. And we think it's related to the vitamin D and calcium because you don't get all that sun in the winter.
Correct.
Especially if you live in a place like Pittsburgh, we don't get much sun at all.
Even in the summer. So what if bending over always results in lightheadedness?
Well, it can be for two reasons. It could be because there's a drop in blood pressure. right? That's one reason. That's why we always check people's blood pressure to make sure that it's not from the heart. But you can also get really dizzy every time you bend over because these crystals are moving. And if the crystals are moving, some people don't say they spin, some people just say they're dizzy.
So then we have another question that kind of relates to that. And it says, how do you differentiate whether the dizziness is caused by BPPV or hypotension, orthostatic hypotension?
Sure. So orthostatic hypotension is a fancy word for meaning that your blood pressure drops when you go from lying down to sitting up.
Okay.
And I follow the European guidelines where what you do is you put a blood pressure cuff on someone's arm.
Mhm.
Usually I use an arm, and you take it and you let them lay there for up to 5 minutes. That's what I do. I leave the room because that's what the guidelines say. And then what you do is you stand them up quickly and you check their blood pressure again. And if their blood pressure drops more than 20 when they first stand up, that means that their blood pressure is dropping, and that most likely is the cause of the dizziness. Now, at the same time, I would still go ahead and do that test that you saw me do, or you saw Dr. Cohen do from
Mhm.
France, that video, where you bring the person down and back up, because you could have two problems. I gotta always check. So people come in, I see very interesting persons come in at Ioneer. They may have one problem, they may have two kinds of dizziness. So you could actually have a drop in blood pressure, and you could have loose crystals, sorry to say, but the loose crystals are fixable. So that
Yeah.
a little harder you can still fix hypotension too, but it's a little bit more work. Yeah.
So on that note, we have two other questions about different issues that might cause this. What are your thoughts on anxiety also being a factor? I'm not sure if anxiety causes BPPV, but I do know that BPPV causes anxiety. How do you treat the anxiety aspect? It's a great question.
Well, anxiety has nothing to do with BPPV, but if you're
Okay.
anxious over your BPPV, that's one of the reasons why I like to bring people back. And that's not a person who probably should be trying to fix their crystals on their own.
Right.
Because people are scared. I understand that. And you need a little helping hand. You need to know that you can move, better after. And I didn't mention this, which I probably should have. And that is that we know that, especially in older people who have loose crystals, that even after you fix the loose crystals, their balance can be off for anywhere from, the reports in the literature, anywhere between 1 and 3 months. I always try and get people to come back, especially if they're older, to do what I call balance tune-up, like your car.
Yes.
Running a little rough. So it pays to come back in and check to make sure your balance is okay, because we know that people are off. And especially if you're worried, if you're a worrier, it's better to kind of work through that slowly and get your balance tuned up, and then people feel good and are able to do what they want to do.
Well, absolutely. So the other disease state we're talking about is, how is dizziness from BPPV different from dizziness due to Meniere's? And can BPPV cause you to have nausea but no dizziness? It's a great question.
Okay, can BPV cause you to have nausea, no dizziness? Absolutely. So people may just feel, in fact, that vestibular agnosia thing that I showed, that the man who was down there and his eyes were jumping, and he said, I don't feel anything. People will often just say, I feel sick to my stomach. So that's not uncommon at all. So I've definitely seen that. Now, the first part is Meniere's and BPV, are they different? They are, but it's not uncommon. It's kind of like they're twins. They're like kind of married. It's not uncommon to have Meniere's disease and also have loose crystals. I see that, and it's in the literature. So you can have both, but they're very different. You can fix BPPV and you still have Meniere's. And Meniere's, the attacks can last minutes to hours, up to 24 hours is typically what we think of, because that's a tough problem, Meniere's disease. But you can't always, and anxiety can make Meniere's worse, but anxiety would never make BPPV worse. It would make Meniere's worse, though.
Okay.
So can bring on an attack.
Right. So we had a question, very interesting one. What about getting the crystals all removed?
You don't want to do that. It's major,
Okay.
major surgery, and your
Major.
balance won't be so good. Yeah, I can sit. I mean, this may look like it's not that far in your head, but it's a lot further than I'd want anybody to go in my head.
Yeah.
So you don't want to. You don't want to. I mean, can it be done? Yes. The answer is yes. Would anybody disable a whole ear to do a whole inner ear? No.
Okay.
There is, to be honest, there is a surgery to plug the canal when it's intractable. There's nothing else anybody can do. And they are 100% sure of which ear it is and which canal it is. Otherwise, no physician who's any good is ever going to touch you. And I've asked Dr. Hirsch this, like, how often do you do that surgery to disable a canal for loose
Mhm.
crystals? And he says, maybe once every 3 years. So
That's
this is,
rare then.
and he's good at this stuff.
Yeah.
So it is rare that any physician would touch you to do that, because it's a serious, anything to me that's close to your brain is a serious operation.
Oh, yes. So speaking of brain and vision and everything else, can people with low vision be checked for this condition?
Absolutely. Absolutely. And someone with low vision, when
Mhm.
I put them down in that position, they're going to look like anybody else.
Okay.
The eye is going to jump and it'll be classic. And if someone has eye weakness, one of the muscles in the eye don't work, I'll still be able to tell that they have loose crystals by doing those tests.
That is great to know because, we have
Mhm.
people from both sides of the house, eye and ear, on this webinar today. So great question was also asked. Prevention was not addressed. What can someone do to prevent this? Is it possible?
To prevent BPPV,
Mhm.
don't bonk your head, number one.
Okay.
Because
Yeah.
it can occur from hitting your head. That's not
Okay.
good. And we're all careful about that. Only vitamin D and calcium is the only thing that we know right now. And everybody in the world asks that question, which is a very good one that, and my patients do every day when I see them. But the answer is vitamin D and calcium, but it's only if you're low that can prevent it. There is one study that says there may be a genetic link, but there's not been much genetic work done on BPPV yet. And there's another study by Gizzy out of New Jersey that suggests that it may run in families. So they noticed people were 5 times more likely to have BPPV if they had a family member who had it. If you've had it, you might want to talk to your brothers and sisters or your mother and father, because it's not unusual that you'll find that they might have had it too. They just never told you that.
Right. Or they may not have realized that it was really something.
Right. And then you may be able to help them get it fixed. So that's really an important take-home message.
Exactly. So we have time for one last question. If we did not get to your questions today, we will get them answered and sent back out to you. So we'll get everything done very soon, but we have time for one last one today. Can this affect hearing loss? Can this cause hearing loss?
Nope.
No.
They're right next door, right?
Mm-hmm.
But this is a physical problem kind of with loose crystals, and those loose crystals don't go over to this side, to the hearing side.
Okay.
Where this L is, that's hearing. So you can have deafness and loose crystals. You can have good hearing and loose crystals.
Crystals. Not
Mhm.
related. Well,
Mhm.
Dr. Whitney, thank you so much. For those of you who had other questions for Dr. Whitney and we did not get to them, we will get these answered for you. We have a list of them and we'll get it sent back out. And also, Dr. Whitney, if you'll provide that list of papers and research that you had in
sure.
your presentation, we're going to put it on our website. So
Great.
that's going to be available very soon to all of our followers as well. Well, thank you so much. We're back to you in 2 weeks with another webinar on ophthalmology. Take care and have a good weekend. Thank you.